Leukemia is a complex and diverse group of blood cancers that affect the bone marrow, blood, and lymphatic system. It is characterized by the uncontrolled growth of abnormal white blood cells, which can crowd out healthy blood cells. In this comprehensive guide, we will explore what leukemia is, the staging system for leukemia, the prognosis at different stages, list of organizations that provide support, and much more. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerself-defense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. What is leukemia? Leukemia is a type of cancer that originates in the bone marrow, where blood cells are produced. It primarily affects white blood cells, but can also involve red blood cells and platelets. The four main types of leukemia are acute lymphoblastic leukemia, ALL, a rapidly progressing cancer that primarily affects lymphocytes, a type of white blood cell. It is most common in children. Chronic lymphocytic leukemia, CLL, a slow-progressing cancer that affects mature lymphocytes, mainly in adults. Acute myeloid leukemia, AML, a rapidly progressing cancer that affects myeloid cells, including red blood cells, platelets, and certain white blood cells. Chronic myeloid leukemia, CML, a slowly progressing cancer that affects myeloid cells and is characterized by the presence of the Philadelphia chromosome. Staging system for leukemia. Unlike solid tumors, leukemia is not typically staged using a numerical system like stages I to IV. Instead, it is categorized based on factors such as the type of leukemia, the percentage of abnormal cells in the bone marrow, and the presence of certain genetic mutations. Leukemia is generally classified as acute. The cancer progresses rapidly, and there is a high number of immature blood cells in the bone marrow. Chronic. The cancer progresses more slowly, and there are more mature blood cells in the bone marrow. Prognosis for early-stage leukemia. The prognosis for early-stage leukemia varies depending on the type and specific characteristics of the disease. In general, early diagnosis and treatment can significantly improve outcomes. For example, early-stage CLL may not require immediate treatment, while early-stage AML typically requires aggressive therapy. The 5-year survival rates for early-stage leukemia can range from 40% to 90% or higher, depending on the type and treatment response. Prognosis for late-stage leukemia. Late-stage leukemia, especially if it has become resistant to treatment or has transformed into a more aggressive form, often has a less favorable prognosis. The 5-year survival rates for advanced-stage leukemia may be lower, ranging from 10% to 50%, depending on the specific type, genetic factors, and available treatment options. Types of leukemia and their prognosis. Acute lymphoblastic leukemia, ALL. ALL is the most common childhood leukemia. The prognosis varies but can be quite favorable, with a 5-year survival rate of approximately 85% for children and about 50 to 60% for adults. Chronic lymphocytic leukemia, CLL. CLL typically progresses slowly, and many individuals may not require immediate treatment. The 5-year survival rate is high, often exceeding 85%. Acute myeloid leukemia, AML. AML is an aggressive leukemia that requires prompt treatment. The prognosis varies based on factors such as age and genetic mutations, with an overall 5-year survival rate of approximately 25–30%. Chronic myeloid leukemia, CML. CML responds well to targeted therapies, such as tyrosine kinase inhibitors. With these treatments, the 5-year survival rate is around 90%. AML is typically regarded as the most aggressive form of leukemia. ALL is the second most aggressive, CML is the third most aggressive, and CLL is the least aggressive. Standard of care treatment for leukemia. The treatment options for leukemia vary depending on the specific type, stage, and individual patient factors. A multidisciplinary team of healthcare professionals, including hematologists, oncologists, and transplant specialists, typically work together to determine the most appropriate treatment plan. Here's an overview of the range of treatment options for leukemia. Mainstay of treatment chemotherapy involves the use of drugs to kill cancer cells or prevent their growth. It is the primary treatment for many types of leukemia, particularly acute leukemias like acute lymphoblastic leukemia, ALL, and acute myeloid leukemia, AML. Combination therapy. Often, multiple chemotherapy drugs are used in combination to maximize effectiveness and minimize the risk of resistance. Chemotherapy regimens may be administered in cycles with rest periods in between to allow the body to recover. Oral and intravenous administration. Chemotherapy drugs can be taken orally as pills or administered intravenously through a vein. Targeted therapy. Specific molecular targets. Targeted therapies are designed to target specific molecules or pathways involved in the growth and survival of leukemia cells. For example, tyrosine kinase inhibitors, TKIs, like imatinib, are used to treat chronic myeloid leukemia, CML, by inhibiting the BCR-ABL protein. Precision medicine. Targeted therapies are a form of precision medicine, as they are tailored to the patient's specific genetic and molecular profile. Immunotherapy, CRT cell therapy, chimeric antigen receptor, T-cell, CRT, therapy involves modifying a patient's own T cells to recognize and attack leukemia cells. CRT therapy has shown remarkable success, especially in the treatment of relapsed or refractory acute lymphoblastic leukemia. ALL. Bone marrow transplantation, hematopoietic stem cell transplant, allogeneic transplant. In an allogeneic transplant, healthy stem cells from a donor, usually a family member or unrelated matched donor, are infused into the patient's bloodstream after high-dose chemotherapy or radiation therapy. These donor cells then replace the patient's damaged bone marrow. Autologous transplant. In an autologous transplant, the patient's own stem cells are collected before high-dose chemotherapy and then reinfused afterward. This approach is used in certain cases of lymphocytic leukemia. Complications and risks. Bone marrow transplantation carries risks, including graft versus host disease in allogeneic transplants and infection. Close monitoring and specialized care are essential. Localized treatment. Radiation therapy uses high-energy beams of radiation to target and kill leukemia cells in specific areas of the body. It is primarily used in cases where leukemia cells have spread to the central nervous system, CNS, or as part of the conditioning regimen before a bone marrow transplant. Side effects. Radiation therapy can have side effects including skin irritation, fatigue, and, in some cases, long-term effects on the bone marrow. Stem cell growth factors. Patients undergoing intensive chemotherapy or stem cell transplantation may receive growth factors to stimulate the production of healthy blood cells. Investigational therapies. Participation in clinical trials may offer access to new and innovative treatments for leukemia. These trials explore novel therapies, including new drugs, targeted agents, and immunotherapies. One way to research promising therapies for leukemia is to visit onclive.com. The choice of treatment depends on several factors, including the type of leukemia, the patient's age and overall health, the stage of the disease, and genetic and molecular characteristics. Treatment plans are often individualized, and patients should have open and thorough discussions with their healthcare team to make informed decisions about their care. Treatment for pediatric leukemia versus adult leukemia. Treatment for pediatric leukemia and adult leukemia shares many similarities, such as chemotherapy, stem cell transplantation, targeted therapies, and immunotherapy. However, There are important differences in how these treatments are applied, the types of leukemia that are more common in each group, and the potential long-term effects of treatment. 1. Disease types: pediatric leukemia, acute lymphoblastic leukemia, all, is the most common type of leukemia in children, accounting for about 80 to 85% of pediatric cases. Acute myeloid leukemia, AML, is less common in children. Adult leukemia: in adults there is a higher prevalence of AML, chronic lymphocytic leukemia, CLL, and chronic myeloid leukemia, CML. 2. Treatment intensity: pediatric leukemia. Treatment for pediatric leukemia is often more intensive and longer in duration than treatment for adult leukemia. The goal is to achieve a cure, as the majority of pediatric leukemia cases are highly curable. Adult leukemia: treatment approaches for adult leukemia are influenced by factors such as the patient's age, overall health, and the presence of certain genetic mutations. Treatment may be less aggressive for older adults or those with other medical conditions. 3. Prophylactic cranial irradiation, PCI. Pediatric leukemia: children with all, especially those at higher risk, may receive prophylactic cranial irradiation to prevent the spread of leukemia cells to the central nervous system. This approach is not typically used in adult leukemia treatment. 4. Late effects of treatment. Pediatric leukemia: survivors of pediatric leukemia are at risk of developing late effects from treatment, such as cognitive and developmental issues, infertility, and secondary cancers. Long-term follow-up care is crucial. Adult leukemia: while late effects can also occur in adult leukemia survivors, they may differ in type and prevalence compared to pediatric survivors. 5. Supportive care and survivorship. Both pediatric and adult leukemia patients benefit from supportive care, including pain management, nutritional support, and psychosocial support. However, pediatric patients often require specialized support to address the unique needs of children and their families. Promising therapeutics for leukemia. Ongoing research in leukemia has led to the development of promising therapeutics, including targeted therapies, drugs that target specific genetic mutations or molecular pathways involved in leukemia, such as tyrosine kinase inhibitors for CML. Immunotherapies, CAR T-cell therapy, which involves modifying a patient's own T-cells to attack leukemia cells, has shown promising results, particularly in relapsed or refractory. All two generic drugs that have shown promise against leukemia are thalidomide and mebendazole. These are both discussed in detail in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. Why is leukemia tricky? Leukemia presents several unique challenges. Heterogeneity. Leukemia encompasses a range of subtypes with distinct genetic and biological characteristics, making it challenging to develop one-size-fits-all treatments. Resistant disease. Some forms of leukemia can become resistant to treatment, requiring innovative therapeutic approaches. Pediatric cases. Childhood leukemia demands specialized care and a focus on the long-term effects of treatment on a child's growth and development. FDA-approved medications for leukemia. FDA-approved medications for leukemia vary depending on the specific type and stage. Medications used in leukemia treatment include imatinib, rituximab, and blinatumomab, among others. Risk factors for developing leukemia. Several factors may increase the risk of developing leukemia. Genetic predisposition. Some genetic conditions, such as Down syndrome, are associated with an increased risk of leukemia. Exposure to radiation or chemicals. High-dose radiation or exposure to certain chemicals, such as benzene, may increase the risk. Previous cancer treatment. Some cancer treatments, like radiation therapy or chemotherapy, may increase the risk of developing secondary leukemia. Age. Leukemia can affect individuals of all ages, but is more common in older adults. Viral infections and leukemia. The relationship between viral infections and the onset of leukemia is an area of ongoing research. While no specific viral infection has been definitively linked to all cases of leukemia, Some viruses have been associated with an increased risk of developing certain types of leukemia, particularly in rare cases. Here are a few examples: human T-cell lymphotropic virus, type 1, HTLV1. HTLV1 is a virus that can cause adult T-cell leukemia, lymphoma, ATL, a rare and aggressive form of leukemia lymphoma. HTLV1 is primarily found in certain regions such as Japan, the Caribbean, and parts of Central and South America. Epstein-Barr virus, EBV. EBV is a common virus that is known to infect B cells. It has been associated with an increased risk of developing Burkitt lymphoma, a type of non-Hodgkin lymphoma that can present with leukemia. Human immunodeficiency virus, HIV. People with HIV have an increased risk of developing certain types of leukemia, such as AML and CLL, likely due to the impact of HIV on the immune system. Human herpes virus 8, HHV8. HHV8 has been linked to an increased risk of developing primary effusion lymphoma, PL, a rare form of non-Hodgkin lymphoma that can involve leukemia-like symptoms. It's important to note that these associations are not a direct cause and effect relationship, and most people infected with these viruses do not develop leukemia. Additionally, leukemia is a complex disease with multiple contributing factors, including genetic mutations and environmental exposures. Organizations and resources for leukemia treatment. For individuals and families affected by leukemia, several organizations and resources offer support and information. Leukemia and AMPP Lymphoma Society, LLS, provides comprehensive resources, support, and information on leukemia and lymphoma. American Cancer Society, ACS, offers information on leukemia, treatment options, and support services. For more information, please see the book Cancer Self-Defense 101: Quick Tips to Help You Survive.